Hey guys, good evening. Just wrapping up one of my stroke calls and just wanted to get on here and kind of talk a little bit about stroke because you can't take a stroke call without absolutely having to spread some kind of awareness about stroke itself. I have seen strokes today on both sides of the country, both coasts, and all in between, all ages. And it's one of those things where once you do it enough, you can't not speak out about it. And we need to spread this awareness. So I urge you to please share this video with anyone that you know that may have had a stroke in the past or have had a TIA, a warning sign of a stroke, or a loved one who maybe you've talked with about stroke risk factors. I also think it's appropriate here at the end of Breast Cancer Awareness Month because having breast cancer does increase your risk of stroke. Also, some therapies that we use to treat breast cancer, kind of in the remission phase, or treatments, tamoxifen, things like that, do tend to increase stroke risk. And women, 1 in 5 women is affected by stroke in some way, shape, or form. And we can also get atypical signs of stroke when you are a woman. And being a woman, for whatever reason, we seem to kind of minimize our symptoms, and we put ourselves aside and we look at the health of other people. I had somebody, not today, but recently, who didn't bring themselves in after having multiple TIAs, multiple warning signs of stroke, because she had to take care of one of her family members, and she was afraid she'd have to end up in the hospital. When it comes to stroke, I want you to think of 4 things. So the acronym FAST. Face, so any facial droop that you might see. Arm, have somebody put both arms out, or if you're noticing one arm feels more heavy than the other. Heavy is the term that comes to mind a lot, but when I hear patients say heavy, that really sends my radar up. But you can also have numbness in one arm or one leg, or incoordination. The S in FAST stands for speech, so slurred speech or mixing up your words. Unable to answer questions appropriately. So FAS, and then T stands for time. And this is not the time, for any EMS providers out there, this is not the time that we see the patient having the symptoms or find them with the symptoms. It's the time they were last seen normal, time they were completely normal. That might be before bed. That might be when they got up at 1:30 a.m. to go pee and they were walking fine, had a quick conversation with you, and then got back in bed. That may have been, 12 o'clock before they fell asleep watching a football game. And then they woke up 3 hours later. That is crucial to tell the EMS, to tell the doctors, and your nursing staff when you get to the emergency department. Which brings me to my next point, is to call 911. I've even told patients that if you are in the parking lot of the ER, call 911. That activates lines of care that gets you in and assessed, and gets stroke doctors up on the computers right there, ready to greet you, ready to give you a medicine if we can possibly give you that medicine. Knowing your family's history, if you're taking a loved one, and knowing your own history. Are you on any blood thinners? Have you skipped any doses? Have you taken any supplements? Have you had any recent surgeries or heart attacks or anything like that? Those are the kind of questions that people are going to give you. But we can't ask you those questions to see if you can get the medicine if you don't come to the hospital. Anyone will tell you, we would rather you come and it be a false alarm or not a stroke, and us be able to tell you that and send you home on either a new preventative therapy or with more education and a clean MRI than for you to miss the opportunity to have that evaluation. So do not hesitate. People worry about money and things like that, and I think that is valid, and I hear you. However, when it comes to weighing your lifelong ability to care for yourself, it does not add up. Bills will eventually be paid for or covered by some form of insurance. We can help you get, there's social workers, there's community care people that are here in the hospitals to help you, but we have to be able to take care of you, and that brain tissue is worth far more than any bill. It is quality of life. Okay. So please share this with anybody. And if you have any questions about if you've had recent symptoms, call your doctor. If you don't have a doctor, go get one. Look at our Rodox site, and I'll tag Rodox below. You can hop on at a time that's convenient from you, even from your own home. I will be taking patients very soon if you just want to discuss your stroke history or TIAs that you've had. You want to know, what you can do at home to prevent more TIAs or to start reversing symptoms of stroke and prevent stroke from going forward. That's my favorite thing to talk about, and I'd love to help you. So follow the Rodox site here below. You can also see my personal website. You can sign up there, and you'll be the first to know when my appointments open up. Lastly, I want to end with this. If you do have a history of stroke or family member, wife, spouse, child, mother who has stroke, Dr. Jill Bolt-Taylor, my stroke of insight. I always tell family members about this, in particular if their loved one has aphasia. She had a hemorrhagic stroke, a bleeding stroke, which is not the most common stroke. However, it affected in her a very common area of the brain. And the way that she explains what she's going through, I think can be crucial for family members to understand how they can help their loved one. Because it can cause a lot of anxiety to see your loved one going through something that you can't control. And she gives a lot of really good tips on how to handle that as a caregiver. And if you have suffered a stroke, she also gives a lot of very interesting, insightful commentary on kind of her thought process on what she was experiencing. And so I think it can also be illuminating. And I've had a lot of feedback from patients that they've really enjoyed watching her, whether it was on Oprah or reading her words, because it gave them comfort that they were unable to give or to get from somebody else. So that's my second tip, is to look at Dr. Jill Bolt-Taylor's book, My Stroke of Insight. All right, I will be coming at you tomorrow. I have another full day of strokes and further inpatient care. If you have any questions, please let me know. There were a couple of questions about prevention I got today that we will be talking about tomorrow. But keep sending them over, and we will try to get them answered. So I hope you guys have a great night and get some sleep. I am going to cut off my computer and get rested and prepare myself for tomorrow. So tune in, and we'll talk then.